Welcome to Optimum Health For All. I'm your host, OJ Odia. Today, we're going to talk about a very serious condition or something that may not be too pleasant for most of us. That is suicide. Why would somebody want to take his or her own life? What are the underlying causes? Why would somebody just decide to end it all? Today we have mental health experts, Professor Princewill Stanley. Professor Stanley, you're welcome.
Thank you very much.
So the question is, why would somebody want to commit suicide? What are the underlying causes?
Yes, sir. Thank you very much, sir, for this question. Let's first of all define suicide as an act intentionally by which an individual takes his or her own life. And it is known by research and documentation that about nearly 1 million on yearly basis take their own lives. Exactly, most of the time they say 700,000 or 703, even more than that, because there are many unreported cases of suicide, particularly in our African community, where persons whose family indulge in it appear to be ostracized because it's seen as a taboo. And so those ones may intentionally conceal such information. But speaking broadly, there are many reasons why somebody can commit suicide. It could result from mental illness. It could be as a result of drug and substance use. It could be due to psychosocial difficulties in life. And of course, today we talk about Nigeria having being in the group of countries among the multidimensionally poor persons. And those could be some of the reasons why people, after they have tried all efforts they decide to take their lives. Physical conditions can also lead to that. And recently, people are beginning to look at, again, the area of euthanasia, where the doctor can now be permitted to assist a person take his or her own life, where this is akin to assisted suicide. There are many other conditions. There are people who are naturally violent, and they may have led the process of violence, and also as a result of illness like temporal lobe epilepsy or seizure disorders could make somebody commit suicide. Having said this, we have measures through which we can truly assess the severity of suicide. We'll take that later. Where, first of all, I would consider it very necessary to state clearly that in our own environment, the commonest cause of suicide is usually a depressive illness. Most persons go through various levels of depression without being identified by members of the community, general physicians, and in fact, even to the best of hands, sometimes it could slip through, because most of the times they tend to conceal information. Other times, through some mannerism or behavior, when they begin to be very inquisitive and asking for to have some access to poisons. If you are not somebody that is quite suspicious, you may not take it. For instance, somebody said, I want so quality or quantity of pesticides, and you don't ask what for. Are you a farmer? He says, yes, I have just started farming. Where is the farming location? What is the size? And how will you be needing this quantity? So these are some of the ways you can actually stop them from doing it. But if somebody now makes a request about poisonous substances or others and is given to such a person goes ahead. But most importantly, we understand the fact that mental illness is not only when somebody becomes overly psychotic. When a person passes through the process of difficulties of life, when we say repeated failures, unabating stressors of life, the person may lapse into a depressive illness. And it's been documented that about 15 to 20% of the severely depressed persons commit complete suicide. About 45% of them can attempt, but 15 to 20 complete suicide.
Now, I think that's suicide.
Yes, sir.
Sometimes people try to commit suicide just to seek attention.
Yes.
So they are calling for help.
Yes.
So those who attempt suicide, are they different from those who really commit suicide? Is there any difference?
Okay, so the fact that somebody wanted to commit suicide but did not succeed does not remove him or her from the danger list. They are different from the people we refer to as those deliberate self-harm. The deliberate self-harm are persons who intentionally wanted to get some reasonable attention, probably for some to gain from that. They are not classified under attempted suicide. There was a patient I saw in one of the companies, oil companies in Port Harcourt. This lady had that the husband that she has married for over 6 years, and they've been attempting, both of them, to have a baby, and they have been having difficulty. The man had some level of oligospermia, and the wife also had a little issue, but his own was worse. And suddenly they said this man now has 2 babies for somebody in Calabar. But later, the woman now wanted to attract the attention in the attempt to pretend to hang herself. This seat, exactly this type of plastic seat, she were climbed on, gateway, and she was strapped up. But luckily for her, neighbors who were outside, it was a Saturday, noticed that the wife of their neighbor was hanging and swinging. They rushed into the house and saw what, and she had already gone into coma, and she was moved to the clinic of the company. And when I came there during the interview, we established the fact that it was a what we call deliberate self-harm that went the wrong or
what arrived.
Incidentally, in the process, we were able to find that the man was not responsible for those.
Because the man was responsible.
Yes,
but
requested their DNA
and lifted pregnancy.
Yeah.
Yes. And
so you could see that will create the difference between attempted suicide and deliberate self-harm. Most of the time they use benzodiazepines.
Yes.
And
not that they won't die.
They won't die.
Or at least, but they would have called attention.
Frightened the spouse. That is how we can differentiate it. But the truth remains that when we want to assess the possibility of a repeat, because most of the times those who have intended to commit suicide usually complete it if adequate precautions are not there to protect them. So there is what we call assessment to determine the risk value, whether it's high risk or low risk. Number one is the instrument that was employed. Number two was, is there any evidence to conceal the act? Number three, was there any prior arrangement, or was it a spontaneous act? That one is less likely to be severe. And number four, was there any final act? Did he or she write a note and say, let me go and rest so that you can continue? Those four factors show that there is a high risk. Number five, under minor, you check of a mental illness. Number six, physical illness that had really endured.
Endured for a long time. They say, look, I'm fed up.
Yes.
This is this is the time to go.
To go, yes. Like a hemiplegia that could not recover.
Chronic illness, chronic disease,
conditions that make them quite uncomfortable to live. So those are some of the assessment factors to determine the severity and the possibility of a reoccurrence.
If somebody attempted suicide and fails, there's a possibility that the person will try again.
Yes, sir.
Now, how do we prevent that person from trying again? Is it if one knows about it? Is it possible family members and all that, can family support, or psychotherapy, or is there anything that can maybe prevent that person from trying again?
Yes, sir. Various factors have been put together to help persons who have committed, who attempted and failed in the suicide mission. Number one is, after this assessment, if it is purely due to psychosocial difficulties of life, the person should have a lifeline whereby a means of sustenance can be created. It can be given a regular job, or the social welfare ministry could take over. And also there could be some other social support given to him either by the community, by the local government, or by the state government.
Okay.
Those are the things
we have that done. Give a life night or say, oh, this life is now what?
Yes.
Okay.
There is this Live Life. It's a program by the WHO. And this Live Life is to make sure that people should be prevented from committing suicide. Okay. And they have about 4 components. Number one is making sure that those materials or equipment that help to commit suicide with ease should not be made readily available in the environment.
So that's prevention.
Prevention is, and number two, there's much as possible to provide what we call the social emotional skills to teach young people, because young people are very erratic and irritable.
Yes.
And in the process commit
and no copycat.
Yes, the copycat suicide. This is very, very important. Number three is provision of necessary luxuries of basic life living. And number four is ensuring that they are always given the necessities of life, but jobs that can provide you the necessary things of life. These are the factors that can assist an individual to be sustained. And those who have the tendency and who have actually committed attempted suicide should be on a watch list. And if it's due to depressive illness or any other mental illness, even if it's schizophrenia or even anxiety disorders, the person should be on regular medication. Yes. with a very continuous access to the psychological treatment, the psychotherapist, cognitive behavioral therapy, and all the rest of them, then drug abusers are equally at risk, either through overdose or even become depressed, particularly those alcohol use disorder. They are most of the times depressed and could now commit suicide with ease. Those who are schizophrenic can do it without knowing what they're doing, because they may hear a voice to say, can't you take your life, become Jesus? But it doesn't make sense. But that's a pseudo philosophy, and they can go ahead and do it. So in the same manner, there are those who may not be schizophrenic for other reasons. They hear voices. They can equally do that. Even those who take hallucinogens, the cannabis, ketamine, and cat. These are both real and psilocybin, mescaline. These are both the typical and atypical hallucinogens. Can make somebody hallucinate, hear a voice to say, take your life, and then go ahead and do it. So, having said this, we also know that there are population at risk. The very old persons.
The elderly.
The elderly.
So the people, whether young, old, or old.
Young, and old.
Young, old, and old.
Okay. Yes. Okay. These are persons who are quite exposed.
Is it because of dementia?
May not necessarily. Dementia can be a cause, but not always.
No.
It's due to feeling of failure and frustration. Yes, sir.
And then
abandonment. In fact, abandonment is a major issue when they feel frustrated because they've been abandoned.
The children that they brought up.
Yes,
what they expected will happen. These are the children they have spent all their lives to bring up, and the children are nowhere to be found. Or even completely disregard them.
Yes, sir. That's a major issue. Major issue there. But for the young ones, more of a copycat.
Yes.
They're in adventurism. They want to do something.
If I take this drug, what happen? If I take this, what will happen? I can let me punish my parents that
by taking my life.
Yes. Which completely don't make sense.
It doesn't.
Yeah. So, and there are people who do it for social political reasons. So-called terrorists. Those who kill themselves so that they can harm others.
Yes.
So how do we tackle those people? One, can it be prevented? Well, even if they don't succeed, can they be brought back to normal society?
Yes, sir. That's the process of rehabilitation.
Yeah.
They say take them in, and then there's a word we use. You de-radicalize.
You de-radicalize them
by going through a process of various levels of psychotherapeutic interventions, and that is doable. It's possible because some of the time they think they are fighting a cause.
Which is well, they don't understand the cause we're fighting.
The cause may not even exist. Could be in their own very imagination. And that's Emil Durkheim talked about a social suicidologist when he talked about a few groups of people, we say fatalistic, and these other persons are egoistic, and these ones are fighting their own cause, and this is why they should go ahead to kill themselves in the process of killing others. And so,
because they have been brainwashed.
It's brainwashed. Is the radicalization process where they are giving all sorts of falsified information. If you do this, you will go to heaven or hell.
I mean, heaven rising.
Those kind of discussions that have no living scientific evidence. So those are some of the issues we need to know. And there is a lot that should be done about suicide. Most importantly, information using the media, whether print or the audio, electronic media of any form, to give information about reasons why persons should not take their lives.
Yes.
And also present situations that could minimize the tendencies for somebody to think in such a fatal manner of taking his or her own life.
There's a law in this country now, at least in our country, that somebody who attempts suicide should face the wrath of the law and be punished. This is advisable.
So we have said a lot about this. It's very important to know that most of the times, those who have attempted suicide are mentally ill, most of the times. So it's a double jeopardy you make them face. If instead of bringing them for treatment and rehabilitation, you now send them for prosecution and imprisonment or other punishments. It's a double jeopardy, and it's a travesty of law. It does not make sense at all. That's one of the reasons for which we advocated for the Mental Health Act that came into being after much hullabaloo in, I think, January 2023.
So is the law still there?
The law is still there, but the argument the Association of Psychiatrists in Nigeria have projected appears to be weakening it. And I'm sure by the time the 10th Assembly winds up, there will be a substantial reform.
That's not which can this effect. So at least punishing people who attempt suicide doesn't make sense at all. Because you cannot punish them. In fact, with that, there's another part of suicide or attempt to take their lives.
And they may even complete it in the prison year.
And it's okay, it's time to go. I think they really want me to go.
So they may now look for going to
ways and
somebody who is much stronger and
I'm making it easier. This one no got attempted suicide. This one is So thank you very much, Professor Stanley. I think we have really exhausted this topic. Suicide is not what people want to talk about, but it is there. It does happen. Sometimes families, like you mentioned before, are ostracized because somebody in their family has committed suicide.
Yes.
And it goes down generations. People say, for example, when one is looking for a wife, say,
don't go there.
Go and find out whether there's suicide in their family, whether there's mental health issues in their family, and so on and so forth. So something that people take very seriously. So thank you very much for coming. I think we have really taken much of your time. So I want you to go back to your patients. I'm sure maybe they are still waiting to see you. Thank you so much. And yes, this is our episode for today. Press the subscribe button if you have not already done so. They are part of our community. Anytime we have a new program, a new video, we can guarantee that you will be the first to get it. Thank you very much. Bye for now.